I want all Manitobans to know that we take these recommendations very seriously, and we did not wait for the final report in order to start taking action in these areas. Work has already begun on many of the recommendations at the site and at the regional level as well. Efforts have already been made by Health Incident Command to improve the pandemic response. This includes changing how the planning and operations tables connect to each other and to the long-term care sector as part of the province's overall pandemic response. Work has been done to further strengthen infection prevention and control practices. New measures have been implemented to promote safe visitation by designated caregivers and visitors. This includes updating visitation guidelines, mandating the same protective personal equipment for designated caregivers and staff, and implementing outdoor and indoor visitation shelters to support safe family interactions with residents. We also implemented an asymptomatic personal care home staff surveillance rapid response, rapid testing pilot project, which has now been completed. And we have seen some positive outcomes from this project, and we'll have more to say in the coming days with respect to that. Work has also been done to develop new staffing strategies, including looking at opportunities to redeploy community and continuing care resources to support staffing stabilization in sites with high needs due to the outbreaks. So despite efforts that have already been taken, we of course recognize that there is still more work that needs to be done, and we're committed to implementing all recommendations within this report. I've directed the department to assemble an implementation team. This team will put together a plan to implement all 17 of Dr. Stefenson's recommendations. That plan will be released publicly within 30 days, and the team will provide status updates every 90 days also, which will be public as well, be made public as well. The implementation team will also inform ongoing work to modernize and expand the continuum of care for seniors, including home care, supportive housing, and supports for personal care homes. This work is key to ensuring a range of supports are available for seniors when and where they are needed. This includes looking at options such as enhanced supports for caregivers, expanding self and family managed care options, and building supportive housing capacity as well. Some of this work is already underway as part of Manitoba Health's modernization and Manitoba's clinical and preventive services plan. As plans are finalized, we will be able to share more of the details with respect to those areas. We also know that there is work to do to upgrade our personal care home facilities to provide better care for residents. Many facilities are older and some still have multiple residents in the same room. This has been an ongoing problem for decades and has become even more apparent during the COVID-19 pandemic. That's why our government is calling on the federal government to take action to support some of our most vulnerable citizens, especially now after the COVID-19 pandemic has led to tragedies like the one that occurred at Maples in the long-term care facilities across the country. Their support is needed in the long-term care and to ensure seniors have access to the quality services that they need, want, and deserve. We want the federal government to work with us to increase funding under the Canada Health Transfer and develop long-term funding agreements to support seniors' care across the province.